Welcome back to another episode of Preserve Health Talks. I'm Dr. Pearlstine with my co-host, Leah again. And this morning, we have a special guest from Titusville, Florida, Dr. Grant Marshall from Mission Family Medicine in his new venture, Mission Concierge Care. We're going to talk to him about how he decided to take part of his practice and make it into a concierge practice and how that's benefited both Dr. Marshall and Dr. Marshall's patients. So good morning, Dr. Marshall.
Good morning.
How's everything in Titusville?
It's great. Beautiful day.
Great. So we want to talk to you a little bit about why you do what you do. And I'd like to know, for the audience, what inspired you to carve out a concierge care model within a larger group practice?
So my wife and I came back to her hometown 6 years ago and started Mission Family Medicine. We have a passion for family medicine, love the small town life in Titusville, and really wanted to kind of pour into the community. So we've been doing that for 5 years, and over about the last year, I started feeling this tension where I felt like medicine, the way it currently is being practiced in a standard insurance-only situation or agreement, is not how it's meant to be. The patients weren't getting the most of what I had to offer, and I could feel that tension too. So as insurance keeps cutting back reimbursements, I had shorter and shorter amount of time with each patient, and that's just not where primary care thrives. 10 minutes is not long enough to talk about somebody's cholesterol and their blood pressure, and then deal with things that they have going on acutely, such as knee pain or a loss in the family. So I really felt this desire to do more and kind of bring family medicine really back to its roots, where I had time to interact with my patients, call on them to see how they're doing, check in on them, and help coordinate with their specialists. So those were really kind of the major key drivers that pushed me to concierge style.
So tell us a little bit about your practice and how you decided on the name Mission Concierge Care, and what does that signify to you?
So my wife and I went back and forth about names for a long period of time before we started in Titusville, and I'll give her all the credit. She came up with the name. We feel like we are called to be in Titusville, and we had a Dr. Story, who has since retired, call us when we were living in New Orleans. My wife was active duty in the Navy, and she served 7.5 years, and we were in New Orleans, and he called us and said, "I want you to come and take over my practice. I know your family, and I know what good people they are, and I want you to come interview with me. I don't want to sell my practice to the hospital because I don't think they're going to take good care of my patients." So we came down and just loved being in this I'm from a small town, back to a small town where my patients aren't just patients, they're my neighbors. I see them at the gym. I see them at the grocery store. And I really wanted to be able to pour back into a small community and make it an impact that I can actually sense. So as we were coming up with this name, she said, "You know what? We feel like it's our mission to be here. We feel like God's called us to be here. Well, let's call it Mission Family Medicine." And then we spun off, we have a non-for-profit called Mission Global Ministries. And then I decided, let's keep the theme going. Mission Concierge Care seems like a great name. It's kind of a brand we kind of set up. So it just made sense for Mission Concierge Care.
So how does your concierge practice fit within the larger Mission Family Medicine group structure?
So we have 5 providers now. So my wife and I, both family practitioners, MDs. We have a new MD, Renee Soucier, that joined us in April. And we have a nurse practitioner, Kylie Woodhouse, and a PA, Matt Baker. I'm the only one doing the concierge style. Everybody else is doing standard insurance-only arrangements like I was doing before. We want to be able to serve all people. And I know the concierge model doesn't fit every person and every budget. But for those people that are able to, I wanted to offer that extra level of service. So I run them in parallel. I'm in the same office building, except I have my own little section that I got to put kind of an upper scale finish, more intentional touches to kind of give that elevated experience.
So what services are exclusive to your concierge patients versus the standard practice patients in the Mission group?
So, and that's a great point. One of the key things for us was, how did we differentiate these two service lines? Because our patients would tell us often that, "You guys are doing a great job with my standard insurance only arrangement. What makes this so special?" So that's one thing we've spent a lot of time and intentionality about making this very different. One of the key hallmarks is the amount of time. Time is so valuable for everybody these days, and I try to set aside, at this point, an hour for every patient visit I have, which allows me to spend time and check in with somebody socially. How are they doing? How is their family? Because that affects their health overall. If they had a family member that just passed away, I need to know that because that can affect their blood pressure, for example, or their sleep quality. And then it gives me time to let them go over what they have bringing to the table. Like I mentioned earlier, somebody might have knee pain or, again, a loss in the family or something like that. But then I can go over I call it health maintenance or quality metrics, such as, well, hey, it's been a while since you've had your colonoscopy. We need to get some blood work to watch your cholesterol, allowing time for us to really dive into the details. And also, I love education, spending time on dietary counseling and exercise counseling, things that I have a passion for that I just didn't have time to do before. So I'd say that's the biggest differentiator. The second biggest differentiator is access. I try to make myself available for same-day appointments, either in person, either video call, or like such as Zoom or something like that. I actually have a HIPAA-compliant platform I use that's similar to Zoom called Doxing Me that I use. Or even just a phone call. If somebody's out of town and they can't set up or they don't have a camera, easily accessible, they can access me however they want to, even a text message if they want. So all my patients in concierge care get my phone number. And because with the concierge model, I'm limiting my practice size to about 300 people, I'm able to give my phone number. When I had a practice of 1,900 patients, there's no way that I could give my phone number to all of those people and provide the same level of service that I wanted to.
So, in your experience so far, what do you think is the biggest benefit that your patients have noticed?
I think it's the quality. And one thing I feel like that medicine has been hurting for quality care and a personal connection for so long. People have kind of forgotten to expect that. So I'll have patients that I've had since I started in April say, wow, I can't believe that medicine can be like this. Like, this is the way you hear about in the 1960s and 1950s, how medicine used to be. So I really feel like it's bringing medicine back to its roots, and the patients are really seeing that. I spoke to a patient's husband this morning. She is fighting a battle with cancer, and she's out of town getting care somewhere. And he told me 2 times, he said, I can't tell you how much peace my wife had going into this surgery because she knew that you were with her. You called and checked on her the day before her surgery. You've been texting me as she's been in the recovery. He said, I can't tell you how much peace that is giving her.
Did you have to change your EMR billing process or staffing to accommodate the concierge patients that you are seeing?
That's a great question. As far as the electronic medical record, because we are a 5-provider team, I decided not to change my electronic medical record. All my patients' information was already embedded in that software, so it just made sense to kind of continue that. And I also have a PA and a nurse practitioner that work underneath me, so I still need access to be able to review their charts, or review the notes, and see if they have any questions or medication issues they want me to address. So that just kind of made sense. Staffing-wise, I made a shift in my medical assistant because I really wanted somebody who could show that attention to detail, but also that kind of elevated customer service. Somebody who's warm and friendly, able to remember these details, such as, oh, that's right, Mr. Sampson, for example, has a birthday next week. Let's send them a birthday card. Just things that maybe I would love to do, but aren't on my radar. So she really compliments me very well, and that's how I knew she'd be a great fit as my medical assistant.
That's great. So other than working with me, what was the most challenging part of launching within an existing group practice?
So I think, as I mentioned a minute ago, differentiating the quality of care. Because in the initial stages, I felt like the fact that we do a pretty good job of doing primary care was a hindrance more than a help. Because people asked, well, we feel like we're already getting concierge level care. What makes this so different? So really just kind of setting those differentiating factors and explaining to the patients that it's access to me that you're getting. It's that peace of mind that if something happens, you can pick up the phone and call me. I have a patient who was traveling for business in Atlanta, and she got ill and she didn't want to go to urgent care. She was ill with something that we had talked about previous times, so I knew the background. So I was able to treat her, send something to the pharmacy without her having to stop her plans of her business trip in Atlanta, and she didn't have to step into an urgent care to do that as well. So just showing people that kind of level of care and dedication really is what makes it different.
So let's play devil's advocate for just a second. Have you encountered any skepticism from patients or colleagues? And if so, how have you addressed it?
So, yes, I've encountered both skepticism from colleagues and from patients. I'll speak to the colleagues first. You know, one thing, there's a common misconception that I had a doctor last week say, I think that what you're doing may be, I don't know how it fits with the insurance companies or the contracting. Is this legal to be doing what you're doing? And I was able to say, actually, those are great questions. I have this great partner, Mr. Ira Pearlstine, who has been able to help me with make sure everything I'm doing is above board, legal, and appropriate. He's set up more than 40 practices in the state, or helped set up 40 practices in the state. So he knows that everything is appropriate and above board, and that was one big concern he had. As far as the patient's concerns, it's hard. Whenever somebody offers a higher level service for a higher fee, it's difficult because that in itself selects some people that aren't able to do that. I would love for this level of care to be accessible for everybody, but in the way the modern insurance environment is, it's just not possible. So that's been really tough. And that's why I've kept our standard service line available with my other providers saying, look, it's not that I don't want to care for you. Concierge medicine is not for everybody, but for those that are able to access it and feel the need, it's a great service to offer.
So, looking ahead, do you think your model could be replicated by other physicians in group practices without leaving their current group?
Yeah, that's a great question. I definitely think so. As my patients have been with me for 4 months now, they've experienced the differentiation between standard care and what concierge can provide. And now they're my biggest advocates. They're saying, oh, now that I've experienced what I see in this pamphlet you handed it me, it's very easy to see why this is valuable. And I actually haven't had, outside of 2 patients that stepped away from the concierge program because they moved out of state, I haven't had a single patient leave yet. So they see the value.
So if you had to sum up the difference between traditional care, which you practiced for several years, and now concierge care, if you had to sum it up in one sentence, what would it be?
It's a good question. I think I would say concierge medicine provides you the quality care that you deserve when you need it.
It's been wonderful having you on our show today. We want to bring you back and follow the progress of your practice, particularly since we do the same thing about 70 miles south of you. So
Yes.
for those of you that don't remember who we've been talking to, we've been talking to Dr. Grant Marshall. We're going to flash your name up in just a second, from Mission Concierge Care in Titusville, Florida. Thank you so much for being on our show today. We look forward to seeing you soon. The best of luck to you.
Thank you so much, Dr. Pearlstine. You guys have a blessed day, okay?
Okay, you too.
Bye.
Bye now.
Thank you.